Okay, the date to remember, December 7th. That is when the Medicare annual election period ends. That's the deadline. Here with more, please welcome Dr. Tracy Wakefield from P3 Medical Group, and we've got Chris Carruthers from your insurance company. Guys, a very important time for people, particularly on Medicare, right? So you can make changes at this time. Tell me more about it.
Well, right now is the time when seniors have that opportunity, or other Medicare eligible people, to change their plan. Okay. So I'd really implore everyone to look at, how they're doing, because things may have changed from last year. New things may have happened. They have, new events in their life. So it's time to do a pulse check on is the plan that they're in meeting their needs. Okay. There's a lot of new plans in the city now and a lot of more options, but I'd also want them to focus on, the provider that they have. Are they happy, with the current, physician they're seeing? They might want to make sure there's a network that they're choosing that has the physician they want to see in it.
I gotcha.
Do they get them in? Do they see me when I'm sick? Do they take the time with me that I need? So all those questions they really need to answer now, because they've got to make these changes, and then those changes follow them into next year.
So Dr. Wakefield says make sure you have a doctor that you are working with that you like. Now, Chris, so many different kinds of plans. It kind of makes me, makes my brain hurt a little bit, but you obviously can help us walk us through it.
Correct. So when you're on Medicare, you have two choices. You can have your original Medicare plan with a Medigap plan and a drug plan. Keep in mind you'll have 3 ID cards in your wallet.
Wow, okay.
And so you need to remember to make sure you show your providers your applicable cards so that you have no gap in coverage. The other option is to go with the Medicare Advantage plans, which is the HMO and PPO plans available in Clark County, Nevada. That's what we're all accustomed to having. We're all used to using the network of doctors, right?
Yes.
And we have plans that are very low cost and that are very affordable for people to use. They're also beneficial because having an HMO plan today is different than what it used to be. HMO plans is a team approach of care and not being left alone. And so a very successful way to get care, and becoming very popular, especially the extra benefits that come with them today, such as dental and vision and gym memberships. I'm sure you've heard about those as well, and so on. So yeah, it's a great time to be considering looking at your plans.
Yeah, if you have any questions, going to see your insurance agent like Chris is probably the best way to go. Now, we also have a lot of different events going on in the Valley, Doctor. Tell us about that, what people can learn, and what kind of questions we should be asking.
Really, yeah, a lot of events out in the communities, senior centers, some of the local casinos as well. Really, you want to ask, when I'm looking, one, can a provider see me when I'm sick? Yes. Or are they just going to see me at my regular appointment? When I'm sick, can they get me in?
Yes.
Like I said, do they take the time? Do they understand what my benefits are with my insurance plan? And also, like I said, does the insurance plan meet my needs? Chris mentioned some of the great benefits.
Right?
And some of the benefits are incredible. Like, not only did he mention like dental and vision, but also benefits like transportation, getting you to the important appointments that keep you well.
Right, and so many different things. You definitely need an individualized plan. To get more information from P3 Nevada, you can call 702-333-4700, or you can click on p3nv.org.